It's my first month in Saudi Arabia. This is back in 2021. I have this excruciating pain on my side, and despite my pain tolerance, I tell myself it might be time to actually go to the doctor. So I head to the hospital, and the triage nurse, amazing, is able to understand me. She takes my measurements, and she tells me that a nurse will be in to draw my blood. I wait there, and my nurse comes in. She is so kind, gentle eyes, and we greet each other. Okay, I picked up a little bit at this point. I say assalamu alaikum. Don't leave me hanging, assalamu alaikum. Thank you. Okay, and I've also picked up kullu tamam by this point. Okay, for the record, I also know how to say sida, yameen, and yasar, but I didn't figure out how to put that in this conversation specifically. So she comes, she draws my blood. She is so skilled and so kind while she does it. But you know when there's that awkward air of silence? Like, I want to talk to her. She wants to talk to me. But we're just a little one of those. She leaves the room, and you know how thin that triage wall is? I can hear her going to draw blood on the left side. So she goes in, and I can hear the conversation flowing in Arabic, okay? In fact, she's drawing blood, and I hear a giggle. I said, I'd love to have my blood drawn. I'd love to have a little giggle, but I got awkwardness instead. The thing is, we trust healthcare professionals to save our lives. Why don't we equip them with the words to do it as well? Chances are, if you ask a healthcare professional to deliver care in their native language, they'll do so efficiently, they'll do so kindly, and they'll do so compassionately. On some of the toughest days of our lives, healthcare professionals come in, they ease our worries, they deliver news, and they take care of us. But they face barriers oftentimes in communicating with people that may not understand their native language. The thing is, English is the global language of the world. English accessibility shouldn't be a luxury, it should be a right. And that's the thing about language justice. Language justice is more than words. It isn't just about having a quick conversation, it's about safety, it's about dignity, it's about opportunity. Without being able to access this plethora of words and communication, oftentimes healthcare workers face a silent struggle. But what if we changed that? What if we were able to equip all healthcare professionals with a basis of language specific to their roles so that they are able to deliver healthcare with compassion and clear communication? But it isn't just about conversations. Oftentimes, this can be the difference between life and death. Think about it. When you go into the hospital, oftentimes you are asked a series of questions. This leads to documentations, prognosis, diagnosis, and treatment plans. But what if something gets lost in translation? What if you're sharing what your allergies are, but the nurse isn't able to understand you? What if you have a previous medical history and the doctor isn't able to understand? Sometimes there's no time to wait for a translator. That's why it's very important for there to be a basic level of English understanding for both providers and patients alike. In these moments, it's not just patients that are affected, but providers as well. They walk in confident, and all of a sudden they're not as confident knowing they cannot communicate. Oftentimes they walk in comfortable, but they feel anxious because they have something important to share, but they're not able to do it. But also, patient success and safety is affected. A lot of research demonstrates that with miscommunications in language and linguistic barriers, patients are not able to receive safe and adequate care. This affects documentations, treatment plans, and even prognoses. So what can we do? Realistically, what can we do? Well, we can start by equipping our future healthcare students with a basic level of English language specific to their field. Furthermore, we can pair them with peer mentors who may be native English language speakers. What does that look like? Well, instead of a nurse saying, "Unfortunately, I cannot provide you with your third sick leave of the week," I would teach my students to say, "I don't like my job either, but I'm here, so you have to be here too." This will be able to give care providers the comfort of being able to communicate in a manner that is in plain English. Sometimes it isn't the medical terminology that a patient needs to hear, but that you'll be okay, everything will work out, and I'm sorry for your loss. Our healthcare system functions at its best when we're able to communicate clearly, interdisciplinary teams, between providers and between patients. I look forward, actually, no, I don't look forward to more blood draws, but if I do have to have my blood drawn again, I would love to be able to giggle with my nurse as it happens. Thank you so much.